Good evening. Um, Thank you, board, for just staying over and listening to our comments. It's much appreciated. My name is Kyle Stewart. I'm in Euclid Township. Several have stood up here and spoke about how we need to listen to doctors and the science, and that we need to listen to the CDC. Well, the CDC has changed their minds. They flipped, they flopped. One day we're wearing masks, the next day we're not wearing masks. The one day we're vaccinated, you're okay. The next day you're not okay. So they've gone back and forth, and even professional commentators are out there saying that their message has been very distorted and very hard to follow. So for that to be our agency that we're following, it's kind of, to me, just seems kind of difficult. But in regards to what doctors are saying, in a news story published on August 3rd, it's titled, "Former Biden Advisor Says Cloth Mask Ineffective, Suggests Americans Start Wearing N95 Masks," and it was written by Courtney O'Brien. Dr. Michael Osterholm, he's the director of the Center for Infection Disease Research and Policy at the University of Minnesota, said, and I quote, "We know today that many of the face cloth coverings that people wear are not effective in reducing any of the virus movement in or out." Let me repeat that. He said, quote, "We know today that many of the face cloth coverings that people wear are not effective in reducing any of the virus movement in or out." And he does go on to say that we should be wearing N95 masks. However, students are not wearing N95 masks, and I highly doubt any are going to go out and purchase N95. But students are wearing the exact masks the doctor says that are not very effective in reducing any of the virus movement in or out. Those are not my words. Those are Dr. Michael Osterholm. So I'm asking the board to let our students breathe. Let them see faces. Let them communicate. Let them have a normal school year. They have gone through enough with masks, with plexiglass, with everything going on. Yes, there's risk, but there's risk in getting in the car and driving to work. And I just ask that, for God's sake, the kids have a decent school year. We had 5 suicides last year. 5! I'm sorry, I'm getting riled up. And you cannot tell me that they were not impacted by the environment that they were in. There might have been other issues, but you cannot tell me that they were not impacted by the environment that they were in on a day in, day out school that some described as it was like going to jail. So I ask this board to think about the kids, to think about the mental health, and that we just need to have a decent, normal school year and let our kids be kids. Thank you for your time.